So today I'm going to talk to you about, it's actually a relatively new area of inquiry for me. I guess as I'm getting older, I'm sort of shifting my focus maybe to more current public health problems. Not that chemicals aren't, they are, but a little bit more sort of global type of problems. And so today I'm going to talk to you a little bit about climate change, psychosocial stress, and coastal flooding, sort of leading up to a study that we're just about to start here in New York City. And I think that this is really fascinating for me because it's allowed me to work with my two co-investigators up there. Andy Jewell is an environmental microbiologist, a water microbiologist who works at Lamont Doherty Labs, which is one of the Columbia Geoscience units. And Bejan Yan is an analytical chemist who's also at Lamont Doherty Labs, who works on a variety of contaminants, including those that are found in surface waters and in soils. So it's really been a treat working with them because I've learned so much about microbiology in water and about chemicals in water. And so I wanted to first talk a little bit about psychosocial stress as a multi-level phenomenon. And we all say, oh my, I'm so stressed out and this, that, and the other things happening to me. And it's an individual level, situational, sort of depicted in the, just switch to the laser pointer, right? Sort of depicted in the orange down here. So this is sort of social status. I don't have as much as the next guy. I'm very stressed out. But psychosocial stress works on very different levels, including these socioeconomic levels, which I'll include climate change in, because climate change is really a large-scale phenomena. It has to do not only with the stress that you're experiencing, the stress the environment's experiencing, and how does it trickle down to the individual. And as it does trickle down through the different layers, my house is flooded, I'm exposed to mold, I don't have the money to repair my house, I don't have flood insurance. This is all sort of as a result of a climate change event or a chronic event like ocean rise, so that even people's houses get flooded even when there's no rain event, when there's no hurricane. It's just a high tide and they're experiencing flooding 2, 3, or 4 times a month. So, okay, so now it trickles down, and what happens actually at the individual level and at the level of the brain? So stress sort of, it's been coined, gets under your skin. Okay, and what happens is it results in a situation that we'll call allostatic load. And if you remember from basic biology in high school, you sort of everything has to work nicely together to maintain a steady state in your body. Okay, when something goes awry, these feedback systems all of a sudden act up. And these systems go to the brain, they go to the hippocampus, the amygdala, the HPA axis activation. So you're making a lot of cortisol, which is the stress hormone, and it activates all of these cardiovascular, metabolic, immune, and nervous system. And eventually, the system wears down. So usually, these systems would rise, and you have this response to stress, and then eventually you go back to baseline. Maybe a little above baseline, but you're sort of at a steady state again. What happens if you've activated these systems so many times that this whole breakdown, it breaks down, and you sort of now experience this chronic activation of the HPA axis? Well, it results in something we call allostatic load, and it's measurable. And it's measurable by using some very basic blood tests and physiologic tests that you get in your doctor's office. The doctor measures your blood pressure. The doctor measures your cholesterol. The doctor measures your C-reactive protein levels, a measure of inflammation. And you can take all of those. Teresa Seaman and her colleagues have developed a score to sort of break those up in a specific population, to call the top quartile, give them a score of 1, the worst quartile, and you just add them up. And we've used this allostatic load measure in studies looking at the effects of Hurricane Sandy in pregnant women, and that data is being prepared for publication right now. But it's also this sort of psychosocial stress that you remember from this multi-level trickling down. That's really the concern when you think about climate change, stress, and mental health. Okay. So, this is, this is just looking at coastal flooding from another perspective, and I think Andrea Silverman set this up very nicely. So here you're looking at a doubling of the coastal flood frequency within decades due to sea level rise, not necessarily due to a hurricane, not due to a major climate event, but just due to sort of, this is the sea level rise that we've experienced hypothetically in the last 50 or so years. And now the water level rises. So it used to be if the water level rose, it went to here. Now the wave swash can move from here to here, and a major sort of high tide event. And now you're getting people's basements flooded, and you're getting people's basements flooded, as our community colleagues have told us in Jamaica Bay, which is where I'm getting at the end of this talk, that their basements can flood 3 and 4 times a month. And it's incredibly stressful. They don't know what's in the floodwaters. They don't know what it's doing to their homes. They don't know what it's doing to the environment in Jamaica Bay. And not only is it a local problem, but the coastal flooding is really an international problem. So this is just a map that really shows the amount of sea level rise that double the chances of today's major flood events. And as you can see, especially along equatorial Africa over here, you're going to get the flood risk is going to double with just an increase of the sea of 2 to 2.5 centimeters. So this is not only a local phenomena, but it's actually an international phenomena with all of the trickle down of effects to the health of already vulnerable populations and populations that are in need because they're exposed to parasitic disease, as you heard this morning. They're exposed to other sources of stressors in the environment. So what happens here? So in this cartoon, really, if you have flooding in mental health here, what happens when there's a flooding event to individual mental health? Okay, well, you have mental health impacts, and there's studies that suggest all of these outcomes. This is still sort of a hypothetical model that we need to start filling in the blanks, and it's really imperative to fill in the blanks, to look at where we have to plan for interventions when we see a community that's more susceptible to coastal flooding. So you have mental health events including suicide, PTSD, anxiety, alcohol, tobacco, and other street drug use. You have management actions that need to come into how do we plan for these events? How do we make sure that there are enough mental health services and outreach services to cover these communities? You have the narratives that people tell you, that people talk about short-term flooding and the fear and the panic, the anxiety, the effect on the children, the effect that they think that they may have and likely is on the unborn children, because this kind of stress trickles down to the next generation. And also about potentially related factors. What are the other covariates that in epidemiologic terms may act as effect modifiers? For example, is it the effect difference in males and females? Is it different by your sexual identity? Is it different by race? Is it different by social status, by social standing in the community? Because those are all of the resources that have to be considered when you actually do these analyses. Is it different by sort of baseline mental health status as well? Okay. So not only, as Andrea just said, not only does you have this water event, but you also have to consider, this is where Andy and Bejan have been really key in educating me about this, about what kind of anthropogenic contaminants are also related to these urban pathways and that pollute the local water and marine sediments. So, if you're in an area that's prone to coastal flooding, what was the area used for? What are the legacy pollutants in the water? So, as I moved to Jamaica Bay and tell you about that, there used to be paper factories in the middle of Jamaica Bay. All of that sediment is now on the bottom of Jamaica Bay, and as the waters rise, some of that sediment, this is what we're doing, is likely to get into the homes, the soil of the people who live there. Climate change actually likely will increase the sea level, is increasing the sea level, and the frequency of coastal flooding, both of which exacerbate the problem. And we really feel that these health, thank you so much, that these health implications are very broad and that they may be unconstrained. So, moving along, this is just a map of New York City. And this, the color coding on these maps actually refer to hurricane evacuation zones, with the red being the most severe zones, the orange and the yellow lesser, and then the inland areas. All of the red and large portions of the orange areas, just to put it in perspective, were flooded by Hurricane Sandy. Remember Hurricane Sandy? It's kind of hard to forget. So after Hurricane Sandy, we started thinking about the long-term health implications of Hurricane Sandy, and I actually have two projects that deal with Hurricane Sandy. One is a project, 2 minutes, okay. One project is a project that has to do with pregnant women. I'm going to leave that to Dr. Zelikoff, that we had been recruiting a cohort of pregnant women during and before and after Hurricane Sandy, and we've set it up as a story to look at pregnancy outcomes from the stress of Hurricane Sandy. The second project is actually this project in Jamaica Bay, and we're working here, interestingly enough, we're working with our community partners in Jamaica Bay because they've become citizen scientists, and they have a Facebook page where they post pictures after every flood event. They take pictures of their homes and they post them on Facebook. It's very moving, actually. But what we're doing here in the pilot phase of the study, which is where we're now, we're actually going to be working here in Far Rockaway and here in specific areas of Brooklyn to take sediment and soil samples from people's gardens, from their front yards, from various places in their house. We're taking dust samples, and we're looking to see if what's in the water or what's in the sediments match what's in the soil and what's in the dust. Actually, nobody's really done it before. So we're looking at specific chemicals, legacy pollutants from Jamaica Bay, PCBs, heavy metals, and we're looking at some pathogens. That's Andy's area of expertise. But while we're doing that, we're also interviewing the adults in the households, and we're giving them a battery of stress-related questionnaires asking specifically about baseline stress or usual stress, and then stress that's flood-related. We're doing this twice in each household, once at baseline and once about a week after one of these flooding events, to see if there's any changes. And I think I'm probably out of time, but thank you very much.